In this video, we'll walk through the proper steps to administer BioWavePENS treatment using percutaneous electrodes in a clinical setting. BioWavePENS is an in-office medical procedure performed under the supervision of a doctor to ensure safety and effectiveness. It's a patented form of percutaneous electrical nerve stimulation, which is known as PENS. The BioWavePENS system is comprised of a BioWave Pro device and BioWave percutaneous microneedle array electrodes, which are sterile, single-use, and are comprised of 1,014 microneedles, each 3/4 of a millimeter in length. Both components, the BioWave Pro device and the percutaneous electrodes, are Class 2 FDA 510K cleared medical devices. The microneedle array provides a direct conductive pathway through the skin, bypassing the impedance of the skin, allowing the therapeutic electrical signals to pass through into deep tissue directly to pain nerves. We begin the treatment by palpating the region where it hurts to identify the center of the location of the pain. The patient communicates to the provider when the provider has identified the center of the painful location. Use a skin-safe marker to mark the center of each pain site.
Clean the marked area thoroughly with an alcohol prep to disinfect the skin before application.
Allow the skin to dry completely. Carefully, slowly, and gently peel the first electrode off of its protective cup, preventing any kinking of the metal array and avoiding any contact with the microneedles. Place the first electrode directly over the marked site. Apply pressure over the hydrogel around the outside perimeter of the electrode to keep it in place. Repeat this process with the second electrode. Maintain at least 1 inch of spacing between the edges of the electrodes. The edges cannot touch where the patient can receive a burn. Using firm pressure, approximately 10 pounds of force, perpendicular to the back of the electrode, press the center of the first electrode to insert the microneedle array through the epidermis. Repeat this process for the second electrode. Plug the blue connectors from the end of the lead wire cable into each of the blue connectors at the end of each of the electrodes. Plug the single end of the cable into the BioWave Pro stimulator. The provider presses the power button to turn the device on and hands the Pro unit to the patient. The patient can be lying down or seated in a comfortable position. Depends upon what's comfortable for the patient, as well as the location of the body being treated. Instruct the patient to press the plus button to continue increasing the intensity every few minutes as the sensation fades, keeping the sensation strong but always comfortable. The patient should limit movement during the treatment and continue to feel a steady, tolerable, but comfortable tingling and deep pressure sensation throughout the treatment. The patient can continue to press the plus button with individual presses to increase the intensity at any time during the treatment if they so choose. The treatment lasts 30 minutes. When the countdown timer reaches 0 minutes and 0 seconds, the intensity shuts off automatically. The provider removes the electrodes and places the needle side of each electrode against each other to prevent contamination. Then, the provider disposes the single-use electrodes in a sharps disposal container. Pink circles along with a dimple pattern of the needle array and several tiny drops of blood may appear. Sterile gauze can be used to remove any tiny drops of blood, and the pink circles typically resolve within 24 hours. BioWavePENS has the following contraindications. Do not use it if the patient has an implanted cardiac pacemaker. Do not use if the patient is prone to seizures like epilepsy. Do not place electrodes over the heart or across the thoracic volume. Do not place electrodes on the front or the side of the neck, and do not place electrodes on the top of the head. Electrodes must be placed over intact skin, not over open wounds, rashy skin, or sunburned skin. BioWavePENS offers a safe, non-surgical treatment option for pain. Patients report up to 72 hours of relief following a single 30-minute treatment with cumulative benefits from multiple treatments over time. Thank you for watching. For the full protocol or more details, please refer to the BioWavePENS Quick Reference Guide or visit us at biowave.com.